My channel, Negotiator and RN. Thanks for joining me. Please make sure that you like and subscribe. Like this video, subscribe to my channel, leave a comment below. So what are we going to talk about today? Well, guess what? The feds, they're are cracking down on some illegal billing that's going on. And where's that illegal billing happening? Well, it's happening with skilled nursing facilities. So there is a little known department in the federal government that I never heard of before, and it's called the CFPB. It is the Consumer Financial Protection Bureau. They have joined along with the Department of Health and Human Services and the CMS, Center for Medicaid Services, in July, sometime in the summer last year, 2022, and decided that they were going to take some action against skilled nursing facilities about predatory billing practices. So what are predatory billing practices? So what are we talking about? This agency basically oversees credit bureaus, credit reporting, not typically medical billing issues or fraud, but this is exactly the way we need the federal government and agencies to collaborate for the benefit of consumers and the benefit of patients. So what's been happening is that people, take their loved one. The loved one goes into a nursing home. Maybe they go into a skilled nursing facility. There's paperwork that gets signed. Sometimes that paperwork may get signed, after somebody is discharged from a hospital into a skilled nursing facility, or they may go directly into a skilled nursing facility from home or a different kind of setting. It could be assisted living, etc. And they need a higher level of care, which they're not going to get, by the way, anyways, because skilled nursing facilities are a complete dumpster fire unto themselves. And that's, another topic. We're going to touch on that a little bit of how and why this is such an egregious tactic when the care is just not being given to our loved ones, to mostly our elders. But there are a lot of younger people that are in these skilled nursing facilities who have traumatic brain injuries, who've had, car accidents, motorcycle accidents, etc., and need 24/7 care, and their families are not able to care for them, or they do not have families. So it's not always elderly people, but by and large it is. So you go in, your loved one goes into a nursing home. There's paperwork that gets signed. It's a stressful time. You may have flown in. You may not even be local to your loved one. They're going to hand you all this paperwork if your loved one cannot sign it. Sometimes they can. They may not be able to. It just depends on their mental status as well. And part of that, what they're having people sign, which is against the law, is they're having family members and friends, even friends, right? It could be the neighbor signed you in, and they're just signing paperwork saying, hey, I'm going to be responsible for the bill. I'm going to be responsible for whatever you guys at the skilled nursing facility decide to make up and invent as charges, right? Because they don't make their charges transparent, or they're going to add on charges. So this is all completely illegal. So I'm going to go take a deeper dive on this, but I want you all to know that in September, these three agencies submitted and sent out letters to every skilled nursing facility company saying, hey, by the way, we know what you've been doing, that you've been illegally billing people for charges that you're not even allowed to collect from these individuals. You cannot make a family member responsible for the bill on a skilled nursing facility, or a friend, a loved one, a partner, domestic partner, whoever it may be, right? It could be the neighbor who's been kind of the caretaker. It could be a caretaker person, a private caretaker who signed this on. Now they're being sent to collection, wages garnished, liens being put on houses, etc., credit being destroyed, people sending tens of thousands of dollars to these skilled nursing facilities where the money's not even reaching the care level, right? We already know that with these complete understaffing, under-resourced, because it's not just staffing, it's equipment. It's not even having linens to change people's beds enough times a day, not having diapers, not having good quality food. There's just so much going on in nursing homes that the consumers and that we as a public really need to get some attention to, because this is not acceptable. So please go over to that website, the Consumer Financial Protection Bureau. They have a link there where the letter is there. There's a press statement. I'm going to put a link in this video as well to that website. And if I can get a link directly to the letter, I will put that in here. I'm going to go a little deeper on this later, but I wanted to let you guys know about this issue. Do not sign anything. It is really important that you go back if you are a family member and you're the person who signed the paperwork, you go back to that facility and you say, hey, I want a copy of everything I signed. I want to review it, all of it, and I'm entitled to a copy of all of it. And that you make sure that you, in writing, let them know you are not allowed to bill me for any of this. And if you sign paperwork, you need to take them to task and say, hey, guess what? There's a law that makes this illegal, and you guys are breaking the law, and contact the CFPB and contact your state attorneys general in writing, and make sure that you CC each agency, and also that whoever the leadership is of that skilled nursing facility. I have a draft letter that I'm about to finalize that I'm going to give all of you. I'll put it over on my website as soon as my website's back up and running, having a couple glitches right now, but I should have that up and running this weekend. So make sure you guys like and subscribe. And also down below, let me know if this has happened to you. I had this happen to me almost 20 years ago with my mom after she passed away. And I had no idea. I mean, I knew I had not signed anything, so there was no way I was going to pay any money. But they are asking people and having people sign paperwork telling them, yes, you must sign this. And so what are people doing? Of course, they're saying, yeah, I'll sign it, because they don't know. I'm kind of curious also about the ombudsman. There's ombudsman programs in every single SNF in the United States. So I'm kind of wondering where they fall into all this as well, and if they're going to be getting involved, because there are standards for ombudsman, and these are patient care issues. Because again, what they're saying is, hey, we're going to kick grandma out if you don't pay this bill. We're going to kick your dad out and put your dad on the street if you don't pay this bill. Or your child who may have, a spinal injury, whatever it might be, right? So this is, again, extremely illegal, completely unethical. Drop me a comment below if this has happened to you, and what state that you're in and what company is involved. Because we need to hold these companies accountable. These are big, giant financial players. These are multi-billion-dollar companies. There's a whole other topic I'm going to be discussing about how hedge funds have taken over skilled nursing facility ownership, and why that should be illegal. Why that is just part of the problem of the care. When you have such a massively profit-driven system, there is no money left that is even being spent on staffing, on supplies and equipment, and everything else that entails, and medications even, to take care of our loved ones, as these facilities are required to do under law. So again, it is against the law for a skilled nursing facility to bill family members, to bill friends, family members, caregivers, anybody, and hold anybody else responsible for the bill and the financial responsibility of the care of an individual in a skilled nursing home. So I hope that makes sense. Make sure you like and subscribe, you guys. Thanks so much. I'll be back more to do a longer video on this once I get a little more research organized, because there is a lot to kind of look at. I want to see what the fines are. I want to see what the feds are going to do for these skilled nursing facilities that are violating this law. And are they going to be able to go back and say, hey, you need to pay these people back the money that you've taken, the hundreds of thousands of dollars, millions and millions of dollars, of course, collectively. But for some of these people, we're talking hundreds of thousands of dollars, because a private cost of a skilled nursing facility runs upward of $9,000 a month. Believe it or not, when you take a look at the inside of these places. So thanks so much, you guys. I'm going to be talking about this a little bit more later, but make sure you subscribe and like and leave a comment below if you've experienced this predatory billing.